I wonder sometimes if the full story is being presented in some parts of the media, and I've been very concerned about, to some extent, the Gannett stories. Just today, they issued a report in which they said I had tried to stop an investigation earlier. And they printed some correspondence that was involved, but I have a letter here from the head of the Legal Aid of Western Oklahoma, Mr. Novick, addressed to a member of my staff. I gave this to the reporters involved who wrote the story. Why didn't they print it? You know, that's a question. Why aren't they bringing out some of the other materials that they have in their possession? So I'm very concerned that we have a balanced approach, that we not have sensationalism. We don't need sensationalism. What we need is constructive action to help the children.
The act was passed by the House of Representatives last week, Ben, by a 77 to 14 vote, and we're very proud of that strong support that we received for the act, and it indicates that legislators and their constituents want a strong beef promotion bill in Oklahoma. The Senate Ag Committee will consider that bill this Thursday morning, and I really believe that we will get the same percentage of support from the Senate that we got out of the House, and I think the act will be passed, and I think the governor will sign it, and that we'll have a very successful beef promotion program in Oklahoma.
Why are you so supportive of this program? Is it really needed?
Well, yes, Oklahoma is a very important beef cattle industry state, and we need to give more support, particularly, Ben, to the export of our high-quality grain-fed beef to Japan, for example. We think there's a great opportunity there to sell more of our beef in Japan. The consumption in Japan is less than 10 pounds per capita. They have the money to buy our beef with. They like the quality of beef we raise. And more importantly, they are really getting a great advantage over this country in foreign trade by $13 to $18 billion in advantage over the United States. And I believe that our government and the different agricultural industries will encourage Japan sometime to accept and open their markets for more agricultural commodities from the United States to Japan. We'll collect a 25% per head deduction on cattle sold at auctions and cattle slaughtered in Oklahoma. It'll generate about $750,000 to $1 million, and the program will be administered by a 9-member commission made up of cattle producers and feeders and a stocker operator, 2 auction owners. It'll include a dairyman and a slaughter plant owner, a packing plant representative. And we've tried to involve as many segments of the industry as we could. Those people are important to the industry, and we believe that that we can work in the international export area, national advertising and promotion of beef and beef products, as well as promoting here in Oklahoma.
Out of 11 women will have breast cancer in their lives. With this possible bill, those women will now be placed in one of 2 positions. They can automatically take the treatment recommended by their doctor, or they can now take part in the decision of their treatment by knowing the alternatives. The American Cancer Society says that's a good idea.
We need women to be able to say, yes, I have this disease and it is, tragic, and yet I have to live with this disease. And my part in fighting this disease is going to be important in how I do. So therefore, I need to be informed about treatment. I need to be able to make that decision with my physician, and I need to be responsible for myself. The days of women or patients in general being totally irresponsible and being, within the hands of the healthcare system are gone.
These are the alternatives available to a woman with breast cancer, the ones a doctor would be required to tell his patient if the bill passes. They are surgical treatment, the actual removing of the cancer, chemotherapy, the use of drugs, and radiation. It's important to realize that even with the alternatives known, this is not a decision a woman can make on her own. She will still need the doctor to advise her and inform her of the consequences of those alternatives. Sherry Sellers, Action 4. This is a trip one never expects to make, a trip to the emergency room.
Hi. How you doing, sir?
All it takes is one forgetful moment behind the wheel, one accident at home, one suspicious pain, and your whole life will depend on the people in this hospital.
Sir, you're at the hospital now. We're going to put you on our bed and check your vital signs now. How are you feeling?
Before these people can help you, they need your medical records. Will you be able to provide the information vital to your emergency treatment?
We need to put you on the heart monitor.
Most of us won't. Often when a patient enters the emergency room, they can't remember past medical history or what medications they're taking. And if the patient is unconscious, they can't provide any information at all. One Oklahoma company feels they've come up with an answer, the Livecard. With it, your medical history will be in your wallet.
Livecard is a wallet-sized card that carries 8 microfilm frames. The first 2 are what we refer to as the heart of Livecard, which carries a comprehensive medical health history designed by a panel of physicians and emergency nurses to convey communication about the patient that may be necessary in an emergency situation. The other frames can be utilized for a complete reproduction of an electrocardiogram so that we can evaluate new changes, or those other things that a doctor might like to supply to explain his patient's condition further.
The Livecard is designed to eliminate stress and pressure in emergency rooms. Doctors and nurses will be free to focus their attention on the patient. Sherry Sellers, Action 4.
Now that Ed Bell is retired, he's got a lot of time for reading. One of his favorite pastimes is checking out the latest literature on his former boss, Howard Hughes. For nearly a decade between the late 40s and 50s, Bell was the personal pilot for Hughes's business manager, Noah Deathrage. During that time, Bell piloted planes carrying Hollywood notables like Clark Gable and Gary Cooper. 3 times he flew his eccentric billionaire boss on secret trips.
They called me down out of the air, and they said Mr. Hughes wanted me to take him somewhere. So down we went, and 4 hours later Mr. Hughes showed up, and we took off, not knowing where we were going at all. I said, well, Mr. Hughes, which way are we going? And we were the only 2 in the aircraft, and he says, whispered to me, he says, Las Vegas. So that's the way we went to Las Vegas. But every evening at 5 o'clock, Mr. Hughes would call up and say he wanted a 10 o'clock that night departure, and this went on for 10 days. I didn't even have a toothbrush. So I went downtown and bought a wardrobe, toothbrush, and whatever I needed, and charged it to the tool company, and they just paid off like clockwork. They knew Mr. Hughes.
Bell never saw Howard Hughes again after he left the Hughes Tool Company, but since he's been retired, the former pilot has had plenty of time to read and reflect on his years working for the bashful billionaire. Scott Wallace, Action 4.
From a distance, all appears normal at the Regency Towers Apartment. The appearance of normality prevails in the building's lobby as well, where the only hint of Sunday night's events are the headlines on the Monday morning paper. But the night before, the scene was different, with flames shooting out of a 12th floor window and the building's residents rushing for safety. The fire was contained within this one apartment. Concrete construction prevented its spread, but its smoke reached throughout the building. A charred piano bespeaks the rage of the flames that shattered their bounds and looked towards the awaiting city. The Regency is for sale, and the people selling it say the confinement of the blaze is a testimony to the construction of the building.
Oh, I would say the building is probably, if you look at it on the fire standpoint, it's probably one of the safest buildings you could be in if you have to be one where there's a fire.
Fire officials attribute the blaze to an unattended cigarette. They attribute the safe evacuation of the residents to fire consciousness. There are smoke detectors in the individual apartments, and the building management says they have held drills in the past, and they will continue to do so. Officials say that fires are inevitable with a high density of people in any building, and they want to work as best they can to make sure those fires aren't tragic ones. Charles Schnitzer, Action 4.
A heart bypass operation is the most common form of non-emergency surgery, 1 million operations a year. Some doctors feel they're performed too frequently. They like to treat the patient with drugs. But many of the drugs have produced unpleasant side effects. Until now, a new drug called Procardia has entered the medical picture. It was first tried in Europe and Japan. It appears to work quite well. Dr. Mike Zigovitz with the OU Medical School began his medical training with Dr. Christian Bernard in South Africa, and he is very hopeful about Procardia, especially since the FDA approved its use 2 weeks ago.
And it's been shown to be efficacious both in Europe and in Japan in large series of patients. Its mechanism of action is dilatation of the coronary arteries, which are the arteries which supply the heart with oxygen, as well as the peripheral arteries. Those are the arteries into which the heart actually pumps, and so that it has a dual effect of supplying the heart with more oxygen, as well as decreasing the utilization of oxygen by the heart for a fixed amount of work.
Dr. Zigovitz is pioneering the use of this drug in this region. Although he doesn't call it a major breakthrough, he does say it is a significant step in offering an alternative to heart bypass operations, which are now at 1 million a year. Bella Shaw, Action 4 at the VA hospital.
Representative Cleta Deathrage says the latest action against Dr. James came out of frustration. The subcommittee on budgeting has been trying to rework the mental health budget, and they are far past their deadline. She says the committee wants something done.
One of the subcommittee members, in exasperation, realizing that the budget simply is in a shambles and would seem to be not getting full cooperation from the department in explaining their budget. One of the subcommittee members, Representative Denver Talley, offered a motion that the salary of the director be stricken from the current proposal of $80,000 to $5,000 until such time as the Board of Mental Health chooses to hire a commissioner who can in fact administer the department and properly manage the taxpayers' dollars.
Deathrage and other representatives say James is incompetent. How does Dr. James respond to those charges?
Well, I really haven't had an opportunity to respond to those, but I certainly can now, and that's, we have a basic budget document that was negotiated, worked out, with all the hospitals and centers and programs that was approved by the board in August that we've stood by. I don't think a dollar has been changed in it since August, and the governor, approved so much of it, and so much of it he didn't approve. We're supporting what he did approve, and when called upon, we described the other needs. So our basic budget request hasn't changed one bit.
James says he's a reformer and that he knew his work wouldn't be popular when he took the post. He also says Governor Nigh and the commission have asked him to stay, and he will, despite the efforts from the legislature. Charles Schnetzer, Action 4.
Some agencies reorganize every year, and
Over 6,000 kids go to daycare centers in Oklahoma County. Since the first of the year, 31 cases of infectious hepatitis have been reported at the centers. Although only 7 of them have been involved in the hepatitis cases, all of the daycare centers are now taking precautionary measures.
We have not had any hepatitis at all, and the only precaution we are taking is asking new children when they come if they're being transferred in from other daycare centers. Staff, I have told them to be extremely careful in washing their hands, washing the children's hands before meals, after they use the bathroom. We use all disposable kitchen appliances here as far as paper plates and paper cups, things like that.
In addition, the County Health Department recommends spraying table surfaces and toys with a Clorox solution and separating food preparation areas from the other care center operations. There's reason for concern about the number of hepatitis cases, but the Health Department doesn't regard it as an epidemic.
The number of cases and the number of centers involved thus far in the county clearly shows that there's not an epidemic. There is an alert that's been called to make sure that we don't have an epidemic at this time.
Dr. Cameron urges all parents to be on the lookout for symptoms of hepatitis in their children. These can include fever, yellowing of the eyes or skin, darker urine, and an overall achy feeling. He says that so far the cooperation among parents, physicians, and daycare centers has been excellent. But investigation by his department will continue until the disease is under control. Carol Lambert, Action 4.
Today's file concerns Robert J. Robert was a 17-year-old student at the Helena State School in May of 1980. According to previously published reports, Robert was placed in handcuffs for being out of control on May 12th. Helena security officer James Wade then allegedly tightened the cuffs down as tight as possible. The Helena Advocate Defender's report on the incident concludes, information gathered from staff and student tends to substantiate the allegation. The Helena superintendent's response agrees. Mr. Wade has been repeatedly told not to use excessive force. I am recommending his termination. Wade was not fired. Instead, he was transferred to another juvenile institution in Sand Springs. A week later, he quit to become a jailer for the Tulsa County Sheriff's Department.
It was a youth guidance specialist who thought that the handcuffs were on too tight. And if I were in Mr. Wade's place, in his shoes, I might feel otherwise. So I really wouldn't want to be a judge. If I were there, I might have wanted to be sure that the handcuffs were secure. This young man, as you can tell by reading his record, was an extremely aggressive, assaultive person.
Robert J's file shows that he was placed in detention more than 10 times while at Helena. His offenses ranged from slugging a counselor to participating in the gang rape of another student. Robert J's file was closed on his 18th birthday. Scott Wallace, Action 4 at the State Department of Human Services.
One person has to come up and accept an award like this, as you can imagine.
Last time I was at a place like this, in commemoration of our state's 75th anniversary of statehood, Oklahoma will be the featured state in the festival held on the National Mall in Washington, D.C. In June 1982, 90 Oklahomans will have the opportunity to travel to Washington, D.C. to participate in the 1982 Festival of American Folk Live, co-sponsored by the Smithsonian Institution and the National Park Service. And this, to have Oklahoma in its Diamond Jubilee year as the state that is featured, is an unusual opportunity because it's a direct result of the Diamond Jubilee Commission's efforts, but it is the best attended and the major event in Washington each year.
If we don't pass this bill, and if this bill does not become law, then there are going to be another 20 to 25 kids that die this year. I mean, there's nothing else to say about that. Again, I don't have the answers, Mr. Speaker, but I just ask you to join with me. Let's vote yes. Let's say that it's the policy of this state that we want kids in car seats, and we're going to try to protect the lives of those that are out there.
Drunk drivers cause over 50% of all auto fatalities in Oklahoma. We need to address that problem, not pass this silly bill. This is an aspirin for a fatal disease. It's ridiculous. Government intrusion is the biggest complaint that I hear. Government intrusion into the lives of individuals. And now we've got Big Brother stepping into the middle of the family and telling Mama what she's going to do with the kids. friend's 1984's here early.
The public employees of the state of Oklahoma don't argue with the legislature trying to increase their salaries, but the Public Employees Association does take issue with a part of the pay hike plan. Two philosophies are at odds. The state wants to spend the money to increase entry-level pay to attract new workers, while the Employees Association wants the money spent to attract workers to stay on the job longer.
Probably the biggest disappointment with House Bill 1527 is the fact that employees that have been with the state 5 years or longer are only going to get a 5% pay raise. And those employees that are just coming into the state or with no experience or coming in at the entry levels of the state are going to get a 15% pay raise. Thus, the state is not rewarding those people for their loyalty and experience to the state.
Governor Nigh says the state is dedicated to rewarding longevity, but they can't this year.
I would just ask the employees and the public to understand this, that it will never be perfect, but we are so far improved as to where we were a year ago that I would like for us to keep our sights upon the great progress we're making and that we will continue to make rather than the shortcomings that are difficult to address.
The Employees Association says that if the current pay plan isn't changed, some employees would be better off by quitting their jobs every 2 years and being rehired. They feel that would be one way of getting higher pay. Charles Schnitzer, Action 4 at the state capitol.
People are moving daily to Oklahoma City because, unlike many parts of the nation, there are jobs available. Because of high interest rates on houses, many are turning to apartments, which have become increasingly difficult to find.
I thought Fort Worth was bad, it was pretty tight there, but, just being here one day, I'm finding out that I was wrong, that this is, a lot harder to get into.
Along with finding an apartment, paying for it's an even bigger problem. An average one-bedroom apartment now goes for $325 a month plus bills. That's a lot for a single person on one income, but people in the business believe the increases are justified.
For many years, rents in Oklahoma City have been unrealistically low because back in 1972, 1973, the owners overbuilt in Oklahoma City and there weren't enough renters to fill these complexes, and as a result prices were held low. And at that period of time, if you were to compare Oklahoma City with Tulsa or Dallas, for example, you'd find that comparable apartments were renting for 50-60% more in those cities because they had not been overbuilt.
Hager says tenants don't see many of the hidden costs in owning and operating an apartment building. Builders whose short-term mortgages have come due are now paying exorbitant interest rates along with higher property taxes. In addition, maintenance and repair costs have inflated tremendously. What's in the future? Well, if the Oklahoma City area continues its current growth, available apartments will be almost non-existent. As for the rent, that can be expected to continue climbing also until lower interest rates make it profitable for new apartment building. Carol Lambert, Action 4.
I've always been
Dissatisfaction with the bankrupt Rock Island Railroad motivated dozens of state and transportation officials to converge on Oklahoma City for the conference. Oklahoma Governor George Nigh setting the pace, calling for the 13 states to work together to speed up the liquidation of the rock. If and when the rock sells some 7,000 miles of track, train service can be restored to farm towns and industry. Rock Island trustee Bill Gibbons has been accused of unnecessarily slowing down the sale of the rock. Critics say the resulting lack of rail service is devastating.
So it's not just a regional problem. It's not just a national problem. It's an international problem. because agriculture and the products of agriculture could become very easily the strongest product we have to bargain with the nations of the world. And we've got to have a way to move it.
Later, Governor Nigh compared the two-day meeting to farming, saying this is the planting, 13 states getting together. Hopefully later there will be a harvest when railroad service is restored in Oklahoma. Larry Otis, Action 4 at the Governor's Conference.